There are very few people, unfortunately, who really know this disorder. You're very privileged just for knowing how to identify what's going on.
Okay.
Then the question is, well, what do you do with it? And there's going to be a lot of people who aren't going to know what they're doing. Make sure if you go to anyone, they understand that you're going to know right away, does this person know about the disorder? Has this person had a lot of experience? And that's going to hit you immediately. And that's what's got to be your guide.
Are you saying that you don't use any psychiatric work at all, and you don't get into why they have it or past, and you just treat it purely from behavioral, maybe just treat the spike, you don't go into, any type of psychiatric probing or what have you? I'm just curious.
I'll answer that with a story that'll take 30 seconds.
Okay.
One of my mentors was a wonderful behaviorist and a sex therapist, and a woman came to him and said she had this unusual disorder called vaginismus, which basically is an anxiety response in the vagina. The walls close up so that they can't have anything penetrate them. And there's a wonderful behavioral approach to that, and we have these little dilators in increasing sizes, and we get the woman to insert it into her vagina in increasing size, and it works 90% of the time. And he said to her, well, have you ever been to a behaviorist before for this? That's the first question I always ask. And she said, yeah. And he said, why didn't it work? And she said, this guy wanted me to insert these dilators into me, and he didn't want to hear about what was going on. And so my mentor, who was going to do exactly that, said to himself and said to her, oh, that's awful. How could he do that? And so he decided to really hear what was going on, and she'd been raped by her uncle. And a year later, he said, and by the way, here are the dilators. And she got better. So to answer your question, I'm a pragmatist. I do what works. And if a person says to me, you really need to understand this before you can help me, I'll spend some time to understand it.
You go by the person, which is good. You don't just purely use the...
No, I'm not a factory.
That's good.
I'm a human.
I was a little worried for a while.
I sound dogmatic.
Where is your office located?
36th Street in Lexington.
Too bad you don't have a subwalk in the neighborhood. Except some of your interns
I'm a
down
Long
here.
Islander.
Okay.
Too bad you have to do it there, though.
No, it's
What time?
Any last questions? Well, thank you.
Thank you.
good.